I'm Robert Lurate. I'm an orthopedic surgeon at HCA Florida West Hospital. I got into orthopedics after initially starting out in engineering in college and coming across orthopedic research as part of my research project in engineering. That's what got me into going to med school, and from there, orthopedics. As an orthopedic surgeon, there's a lot of variability in what people do in that field. My particular interest is spine and adult reconstruction primarily. I do a lot of hip and joint replacement, knee replacements, shoulders. My spine part is more geared toward less invasive, minimally invasive type spine procedures like disc replacements for neck or back, some limited fusions, kyphoplasties, discectomy, decompressions, that sort of thing. For me, the most important part when the patients first come in is actually just hear what their story is. I do get patients that come in that are sent to me because I offer some procedures that other physicians don't offer. So when patients come in, pain is the most common prevailing problem they're here for. And understanding the intensity of the pain, the level of their pain, how it affects them, I think those are all part of hearing their story. And like I said, it helps you direct on which way to manage it, because different levels of pain may have different levels of invasiveness or less invasiveness, or do they even need anything done from a surgical standpoint to solve their pain problem. My interest and passion is to be able to do the surgery that needs to be done to fix the problem with the least invasive intervention. What's nice to see is when somebody has a problem that's taking a toll in their lives, their quality of life, their activities of daily living, and how that affects them. And that if you can fix that problem and see them recover and see how it elevates their quality of life, elevates their activity level, that's hard to beat. I'm here for patients to hear their story, trying to find out the best solution for their problem, and help them have a more robust life.